My name is Dr. Ravneet. I am a consultant in genetics at Motherhood Hospital. I'll be telling you about the common myths about genetic disorders. The first and the most common myth is that since nobody in my family has a genetic disorder, I or my child is not at risk of having a genetic disorder. But the reality is that the genetic disorders can occur in any child. They can start at any generation, and you or your partner might be a carrier of a faulty gene, which unknowingly you might pass on to the child, and so they can be at risk of having a genetic disorder. Secondly, all the genetic disorders present at birth, but the reality is that some of the disorders might present at birth, some of them will present later on during the first month of life, multiples might present at like 4 to 6 years of age during childhood or during adolescence, or they might present in adulthood around 40 to 60 years of age. The third is that one test will detect all the genetic disorders, but no, there are thousands of genetic disorders and there are many tests with different types of basis. So you always consult your doctor which test to be ordered for which genetic disorder. And all the genetic disorders are not treatable, but the reality is that many of the genetic disorders are not treatable with any of the dietary intervention, with some medicines, with some surgical interventions, or with some physical therapies. And fifth, but the most important, is that genetic disorders are rare. But no, the genetic disorders are these days very common. About 1%, about 0.5 to 1% of all the live borns have a chromosomal abnormality. About 15% of all the pediatric admissions have an underlying genetic basis. About 20 to 30% of all the infant deaths have an underlying genetic disorder, and about 5% of all the cancers also have a genetic basis. They have a hereditary potential. So please always consult your doctor to screen you or your family members for presence of any of the genetic disorders.